China and India burdened by untreated mental disorders. The growing burden of untreated mental disorders in the world's two most populous countries, India and China, cannot be adequately addressed without changes to their healthcare systems and by training folk healers to become collaborators, a new report has found. The analysis, published as a part of a series in the journals The Lancet and The Lancet Psychiatry, draws on years of medical surveys in those countries. It represents the latest effort by an international coalition of researchers to put mental health care at the center of the global health agenda. Last month, the World Bank and the World Health Organization convened hundreds of public officials, doctors and other specialists in a landmark meeting in Washington to focus attention on global mental health. The new research, presented in 3 papers, found that less than 10% of people in India and China with a mental disorder received effective treatment, and that the resulting burden of disability from those 2 countries was higher than in all Western countries combined. India and China together represent more than a third of the world's population, and both countries are at a remarkable stage of epidemiologic and demographic transition, said a co-author of one of the papers, Dr. Vikram Patel, a professor of international mental health and co-founder of a community-based mental health center, Sangath, in Goa state in India, in a recorded interview accompanying the articles. One lesson, experts not involved in the research said, is that investment is still lagging well behind spending on other medical conditions. Both countries spent less than 1% of their total medical budget on mental health. I think politicians and service planners will find this research valuable, said Dr. Alex Cohen, the course director of the Global Mental Health Program at the London School of Hygiene and Tropical Medicine. But if you don't have the resources to treat more than 2% of the people who need it, then the overall burden can seem overwhelming.